Hi, my name is Dr. Matthew Kahn, and it's been a real pleasure coming on Chairside Live today. I was with Dr. DeTola, and we decided to take a walk through the lab and maybe find some cases that could use a little bit of help, and wanted to see what type of advice that I could provide as a board-certified prosthodontist on some of their average cases that come through the lab. This is one that we picked out, and it's got a 6-unit lower anterior fixed partial denture. And there's a couple of problems that I see just right off the bat. The impression was made with a double arch impression technique, which works pretty well in terms of capturing the margins and capturing the actual anatomy of the preparation and some of the adjacent teeth. But in a case like this, I think it's really important to be able to extend the impression all the way back to the posterior teeth so that you've got a lot more occlusal stops to be able to mount your casts. But I will typically take a dual arch impression, even for multiple unit restorations, just to be able to make some marginating dies, which sometimes you might get some bubbles when you're taking an impression on multiple teeth. So it would have been better to have additional impressions that were a little bit further extended. Another problem that I see with this impression is that you've missed the entire buccal margin on tooth number 22. So the laboratory technician then has to guess exactly where to place the margin, and that can be a real problem. Another area that I was looking at with this particular case is the distance that we've got from the crown preparation to where you'd expect the incisal edges of your anterior teeth to be. And what we've got is our anterior-posterior spread, the amount of anterior cantilever from the fixed partial denture. In this particular case, we're probably looking at around 6 to 8 millimeters of anterior cantilever. Just like when we're doing an implant bridge, you also look at the anterior-posterior spread. This is also the case with this as well, and you have to be considerate of that. It would have been helpful if the dentist had sent in maybe an impression of the provisionals to kind of give us an idea of exactly how he wanted the laboratory technician to wax up and fabricate this particular restoration. So we've got another case here, which is a little bit different. This is an implant case where we've had 2 opposing implants that were placed by an oral surgeon, and the oral surgeon was the one who placed these prefabricated abutments. The restorative dentist made 2 quadrant impressions, and you can see what the problem is here when we articulate the models, is that we don't have any restorative space. There's really nothing, no space to be able to place any restorations here. Now what the laboratory technicians have done here started the process of making a reduction guide, and with this they can shave off a good millimeter and a half of this particular abutment, and maybe do the same for the other side as well, and then give that to the dentist, who can then take those same reductions on the copings, on the abutments chair side, and then be able to seat the crowns. But in this particular case, we've got some other problems more than just having the insufficient interocclusal space for restorations. The implants, like this particular implant, is positioned at an angle, and the path of insertion for this may be problematic in terms of where the marginal ridges of the adjacent teeth are. So in this particular case, a customized abutment probably would have been beneficial, or even a screw-retained restoration. Same thing with this. A lot of times we can use a screw-retained restoration when we've got minimal interocclusal distance. So my advice to the restorative dentist on this would be to consider replacing these particular abutments with customized abutments, and maybe even consider doing a screw-retained restorations for these 2 restorations. So thank you very much for having me in, and I appreciate having the opportunity to participate in Chairside Live. Thanks.